Hi everyone, and today we're gonna talk about the beta blockers. The beta blockers is also known as beta adrenergic blocking agent. Basically, the beta blockers will block the beta receptor. Well, there's three types of beta receptor, namely beta 1 at the heart and kidney, beta 2 at the lung and liver, and beta 3 at the fat cells. Beta blockers block the beta receptor, meaning it will stimulate the parasympathetic action. If it blocks the beta 1 receptor in the heart, meaning it will slow the heart rate and the blood pressure of the person, and also reduce the heart oxygen demand. It is useful in treating myocardial infarction, angina pectoris, tachycardia, cardiac arrhythmia, glaucoma, hypertension, and high blood pressure. If the beta blockers block only beta 1 receptor, it is cardiac selective, which work basically on the heart. Well, if the beta blockers block both beta 1 and beta 2 receptor, it is non-selective beta blockers. Well, keep in mind that beta 2 receptor basically found in the lung, so beta blockers will cause the bronchoconstriction. This is dangerous for the patient who have respiratory problems, for example, the asthma. Well, the side effects of beta blockers including bradycardia, sudden constriction of the bronchiole, dyspnea, hypertension, and insomnia. It also causes hyperglycemia, which would increase the risk of developing diabetes. The metabolite of beta blockers including the increase in triglyceride, cholesterol, and very low density lipoprotein, and the major urine metabolite is the glucuronide. While some beta blockers also show intrinsic sympathomimetic activities (ISA). It means it simultaneously exhibits as antagonist and low-level agonist. This is very useful in individuals who exhibit excess bradycardia while still require the beta blockers therapy. Some beta blockers are also alpha-1 antagonists, which means it blocks alpha-1 and beta-1 simultaneously to provide extra arteriolar vasodilation. While looking at the first example of beta blockers, the propranolol, or the trade name of Indorol, it discovered by Sir James White Black in the 1916, and he is awarded for the Nobel Prize for the discovery in the 1988. Propranolol is a non-selective and lipid-soluble beta blockers. The lipophilic characteristic makes it easily to cross the blood-brain barrier, and thus may cause sleeping disturbance such as insomnia and nightmare. Dreaming was reduced and increased awakening. The ethical issue of propranolol usage is when stage performers such as musician, dancer, or the public speaker take it to reduce anxiety. It seems to be unfair if it's in a competition. It also used in some high accuracy sports such as archery, shooting, and snooker to improve the performance. Thus, the uses of beta blockers has been banned by the International Olympic Committee. Well, next we're looking at another example of the labetalol. Well, at the trade name of Nomodine. The characteristic is the non-selective alpha and beta antagonist and intrinsic sympathomimetic activities. It functions by decreasing the peripheral vascular resistance, which makes blood easier to flow and circulate, with a significant alteration of heart rate and cardiac output. The side effect is the orthostatic hypotension, which means it's the fall of blood pressure when sudden standing or stretching. Thus, the dose and usage should be monitored closely. Well, that's all for today about the beta blockers. Thanks for watching and have a nice day.